My doctor says I have atrial fibrillation, says I need to go on a blood thinner. Now let's talk about that. Blood thinners, Coumadin, really scare a lot of people, but it's very, very important in people with chronic atrial fibrillation, or they can get a blood clot in one of the chambers of the heart, and that blood clot is thrown up to the brain where you get a stroke. As a matter of fact, 25% of strokes are due to atrial fibrillation. Now, atrial fibrillation, more common in men, more common with age. People can get intermittent atrial fibrillation, where it comes and goes, or it can be chronic atrial fibrillation. Very, very common history is people start getting an irregular rhythm, and they can tell it, and it's frightening, and it scares them, and the doctor says, you have atrial fibrillation, it goes away. It may occur only 3 or 4 hours, and it may occur every 3 to 4 months. Next time, lasts about 6 hours, and then it's every 2 months. And the next time, it's 11 hours, and it occurs every month. It becomes more and more frequent, and it becomes longer and longer. And there's an evolution into chronic atrial fibrillation. Now, chronic atrial fibrillation, and when the intermittent becomes more frequent, are times when you get that blood clot. So what can we do to get rid of atrial fibrillation? There are medicines that we can try to use. There's cardioversion that we can try to use. But the newest treatment is called ablation. And ablation is where they put a little catheter that goes up into the heart and goes up to the chamber of the heart that receives blood from the lungs. It's called the left atrium. And around that left atrium, the doctor can find during that cath where the irritable area is. And he just zaps it zip, 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 with the radio frequency ablation. 85% effective. If it's not effective in that 15%, frequently a second time will keep that rhythm from occurring again. So atrial fibrillation, lots of treatment, lots of good treatment for you.